And I wanted to ask you for patients that you just also in the post-op period, let's say a patient comes to, I mean, after you do the implant, everything is working fine, but they say that it's pointing downward, that it doesn't go up, and when you see in the anatomy, it's just because of the fat pad, it's all over the penis. I mean,
Man, I will never forget it when I was in training. I was in fellowship. There was one guy who, I mean, he even threatened my mentor to sue him, all because this his penis was just like you're saying. It's like it's pointing down, it's not pointing up, and he's upset about that. And we told him, it's like, hey man, this is on you. I mean, you are the one who has that big fat pad that's just creating weight on top of that implant. So now, ever since we had that horrible experience during fellowship, I tell all my patients whenever they have, a large fat pad, I tell them like, hey man, this might create weight on your implant and your penis is not going to look like the mannequin. So, so again, I mean, for those, it's just about trying to avoid these type of scenarios, because these guys can sometimes be very difficult to manage. Every patient with a large panic, I will try to set expectations prior to the surgery. Assuming the patient was properly sized, that there are several tricks that we can try. I mean, I know like Rafael Carrion, he published an article several years ago about placing an implant and at the same time removing that suprapubic fat pad. I mean, you can do that. I don't do that. I usually tell them like, hey, you can see a plastic surgeon for you to do this, just because I don't want to be dealing with it, post-op. And you can also try a ventral phalloplasty for guys who are complaining, worried about their size. It's like, hey, my penis looks smaller. And I tell them like, hey, man, and I usually push the fat once the implant's in, I push the fat pad all against their bone. And I'm like, you can see you have about 3 inches underneath your skin. And again, and I try to tell them like, hey man, when you're having sex, your partner will be creating pressure on top of that. So you will be able to penetrate more than what it actually looks like. And there's also another technique that we can use. It's called a dorsal phalloplasty. This was a technique developed by a surgeon in Egypt. His name is Dr. Shair. And he places sutures from the dermis of the suprapubic fat pad, that skin, and then he tacks it down to the periosteum of the pubic bone. And with those stitches, is basically just like pulling the skin around the shaft down. He's able to expose the penis a little bit more. It will still be looking down, but again, at least it looks like they have a bigger penis.
Okay, good to know. Yeah, I wasn't aware of that one, so I need to take a look at that one.
That just in case that one, especially if it's a redo case, it is painful.
Okay, so forget it. I'll send it to you.